Hello and welcome to the Walrus Leadership Forum on Healthcare. I'm Jennifer Hollett, the Executive Director of the Walrus, and we're thrilled to be joining you virtually today. I'd like to start by acknowledging the land that I'm on right now, Toronto. I come to you from the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat peoples. Toronto has long been a meeting place of Indigenous peoples, and we're really honored to carry on a tradition of conversation. Please take a moment to reflect on the land that you're on, wherever you are in the world, and this moment in history that we're in. A bit about the Walrus. We started 18 years ago as an optimistic project to tell the stories and foster conversations across Canada. And we do this in a variety of ways. Through our fact-based journalism in our print edition of The Walrus, but also online at thewalrus.ca, through our podcast, The Conversation Piece, and also through events like this one. The work that we do is powered by our donors, our supporters, and partners. So thank you all for being here. We are a charity, a not-for-profit, and the support of our sponsors in convening is crucial. So we're really pleased to be partnering with Innovative Medicines Canada on this event. A year into the pandemic now, and it's been a long year, the future of the life sciences sector in Canada has been on the minds of Canadians more than ever before. And so many issues have come to the forefront, including domestic vaccine development, manufacturing capacity, procurement, the role of public and private sectors, as well as addressing barriers to healthcare access. So where does the life sciences sector go from here? And what will it look like when the next public health challenges come along? Because we know this isn't a one-time event. Today, we have brought together Canadian leaders in healthcare and life sciences to share their thoughts. And to begin, we'll have a conversation between André Picard, health reporter and columnist with the Globe and Mail, and Pamela Fralick, president of Innovative Medicines Canada. Then following their conversation, we'll have a panel conversation with Q&A so we can further explore these issues and hear from you, our audience at home. To start off today's discussion, I'd like to welcome André Picard and Pamela Fralick.
Hi, thank you, Jennifer, for the kind introduction and for putting on the event. I see there's a lot of participants, a lot of interest in this issue. So let's jump right into it, Pamela. I want to start with an issue that's just been dominating our lives for the past year, and one's been dominating the headlines for the last week. So COVID-19 and vaccines. Why don't we have domestic production in Canada? Let's start with that big question.
You're starting with the easy question, are you, André? Yeah, and look, as we both know, and everyone listening knows, there is no simple answer to that question, but I can make a couple of observations. From our perspective, from an industry perspective, there have been a series of, I would say, policy decisions made. You can't point your finger at any single stripe of government. It's been over decades. But they have not been embracing of this industry. It has not created an attractive environment for industry to want to come and invest. It is a global industry where decisions are made not necessarily in Canada, they're usually made externally. And so it creates problems. It creates problems in access, creates problems around regulatory regimes, around IP and data protection. These are the sorts of things that an industry looks to be able to thrive and to come and to be there when a country needs them, such as during a pandemic. So that's one observation. The second, don't worry, I'm thinking of two, maybe three. But the second is that, in fact, that is building on that, I guess, the relationship between, and let's call it big pharma, but the life sciences sector to some extent in general, and the federal government has, let's say, has been less than ideal. And we believe that the life sciences sector is critical to Canada, and the innovative side of life sciences is critical to that broad spectrum of life sciences. So we're part of an ecosystem, and when one leg on the stool wobbles, we all falter. If all are doing well, the tide, good tide raises all ships, I would say. So, the global industry has reached out to this government in particular pre-pandemic, trying to establish a working relationship, and has not had its requests accepted, its invitations to have a dialogue accepted. The Canadian industry has made several approaches to the current government to sit down and have that dialogue and really work out what could be best for Canada, meet the objectives of both government and industry. That hasn't happened. So there are places in the world where there may be tensions, as there always are, between government and industry, but you can work to a solution, and that's been missing in this country. I will end my last observation. There's optimism, and the industry is very, very keen to speak with government. We see that what's unfolding in the pandemic really raises the attention, opens the eyes of Canadians and government to what could be and what we need to do. So I'm optimistic.
So we'll get to the optimism, because we certainly need some of that these days. But I want you alluded to a lot of history here, a lot of baggage. Can you touch on, without going through all the gory details of 30 or 40 years of this, what are the highlights or maybe the lowlights of what's gone wrong?
Yeah. How much time do we have again on this? No, just a few
about
minutes.
30 seconds.
Yeah. Look, let's look at the most recent history then, rather than go back through the past. And clearly there is a desire on the government to have a new regulatory regime in place. They've been working on that for a number of years. It is set to come into play on July 1st. For those who don't know it, it's coming through the Patented Medicine Prices Review Board, PMPRB. And it is going to have an extreme impact on this industry. So while we have Health Canada really bringing forward a regime that is going to really bring a lot of the industry to its knees, if you will, in terms of its ability to make the revenues it needs to create those great medicines that we all love. On the other hand, we have ISED industry, another part of Canada, that is really identifying the life sciences sector as an industry that should be embraced and supported and really used to help the economic recovery in Canada. But you can't do both. There has to be balance, and that's really the industry's position. We understand there's a need for sustainability to be looked at in terms of drug prices, but we also know that government wants us to invest in the country, and you can't have both. You have to hit a balance, and that's the biggest problem that's been going on for the last few years.
And on that balance question, some people in the public will say, well, we need lower drug prices. They're too high. We have among the highest drug prices in the world. Why should we be helping out pharma? They already make billions in profits. It's not an easy sell.
No, it isn't. And I can say that, as I made brief reference to a moment ago, industry has gone to government understanding this conundrum and the desire to have lower prices, and gone in with very significant offers of a way that Health Canada can achieve its mandate of lower drug prices, but without sending the message to the global industry that this is not a place to invest. So there's billions of dollars being talked about on the table here. Industry is very open to that discussion. It's not saying, give us all your money and we're going to go away and leave by any means. But again, we have to come back to that issue of balance. And this is where we need a whole of government approach in order to achieve that.
And there's a perception too, the government says, well, we'll invest, we'll give you good regulations, but we want investment in response. There's a perception that industry's not following through on that promise. Is that true?
I think there are a number of things that government can do to make this country more attractive to industry. And we've seen evidence of that. We are encouraged by what just happened. Was it last week or the week before now? You lose track of time in this virtual world. But with the amazing announcement with Sanofi and 3 levels of government here in Canada, bringing a tremendous domestic capacity to Canada, not necessarily in the COVID vaccine, but certainly in domestic capacity of vaccine production. And this is a commercial issue. I don't know all the details of what went on, but clearly the governments came together and made it very, very attractive for that industry to come here, which is fantastic. How much more could we do if we address some of the other issues, that regulatory regime that I've been talking about, see if we can enhance our IP and data protection matters to be a little more on par with some of the other countries that we would like to be like ourselves. So there's more that can be done, but requires dialogue. We need to talk with one another.
So let's talk a bit more about the more that can be done. The government is obviously paying attention now, in part because of COVID. Things have not gone well. The industry, in fact, the whole biotech industry more largely has sent this letter to government saying, we want a strategy, we want to do more. Can you tell us a bit about what the ask is there and how hopeful you are about it?
Yeah, well, and I will make the point, it probably can't, it's not fact-based, but I'm going to make it anyway, that there may be no other industry that's more important to Canada. Certainly we know that the life sciences sector is identified as being extremely important and an industry that will contribute to the well-being of Canada. It straddles health and economic well-being. And COVID itself has revealed to us just how valuable this industry is. It is a miracle that we have a vaccine underway. It's a miracle that we can argue about supply and who's getting it first, et cetera, that we actually have the vaccine. So that would be the first point. The other thing I would say is government itself has done a great job of recognizing the value of the industry. We've seen a report come out a couple of years ago. We call it HBEST, the Health and Biosciences Economic Strategy Table, one of 6 economic papers that was written after Dominic Barton and his council identified us as a sector to support. Great recommendations in there. We're waiting for it to be activated. We've also had the Industry Strategy Council just recently as a result of the pandemic to help with economic recovery. And if you look on page 98, I think, there's a recommendation for a whole of government health and industry and finance of government working together to support this particular industry. So those are things we'd like to follow up on. In terms of IMC specifically, our members within the innovative pharmaceutical industry, first and foremost, let's establish a new and really lasting partnership. Let's figure out how to work together. That would be number one. Number two is to support the uptake and the adoption of innovation. And we are great in Canada. We have a lot of strengths. We don't have the time to go into them, but your panelists, I know, will get into that in a few moments. So let's do a better job of supporting that uptake of innovation. The third piece, we've talked a bit about it, but implement agile, efficient, predictable regulatory systems. We know that any business requires as much predictability as possible to be viable as a business. So let's look at what we can do in that area. And finally, as we've talked about, protect, promote innovation internationally. Let's make sure we're on par with those countries we want to compete with. We are competing with dollars internationally. The fact that Sanofi came here is not accidental. It's not just, oh, well, let's go to Canada for the heck of it. The Canadian CEO had to fight tooth and nail to sell Canada to bring that investment in here. They were able to do it. I come back to my statement of how many more of those are on the table, and we're perhaps missing them because of these issues that we need to address.
And the letter has lots of recommendations on what to do. Is there a price tag on this? It always comes down to money. How much does the government need to invest to fix this sector? I don't have a number for you, André, and maybe some of the panelists will, and Jason Field, Dr. Field, who runs LSO and really mobilized this letter, which was a fantastic statement to all of government, may have some numbers in mind. Because the recommendations that we're making are so broad, they're policy oriented, et cetera, there's not a specific dollar there, but we're happy to come to that table and talk about the details. We, as I say, have certainly tried to assess from our own information about what government is looking for to come up with some numbers. We put those on the table a couple of times. There hasn't been uptake, but we continue for some reason to be optimistic and think that there may be opportunities. The great thing about that open letter, I hope everyone saw it. I'm sure it's available online somewhere. It was in the Globe and Mail. There you have it. I have it in front of me as well somewhere. But if you look at the signatories to that, it's the innovative medicines sector. It's all of the life science provincial bodies across the country. It's the Canadian Chamber of Commerce, et cetera, the Ontario Chamber of Commerce. This is all of business coming together and saying, government, let's work together. We can make this happen. And we'll post a link to that letter in the chat so people who haven't seen it can click on there. I want to, again, talk a bit about the optimism. Are you confident that in the wake of COVID-19, this conversation and this relationship between industry and government is going to change for the better?
Yeah, to my own detriment, probably. Optimism is in my DNA, and so I do err, if you will, on that side. But yes, I am optimistic. I think that COVID-19 has been many things to many people, most of all a huge tragedy and just complete upset of life as we know it. But it also does provide us with that time and the opportunity, I hate using that word, but to look at things differently. And this is what's happening. And we see that Whereas the innovative pharmaceutical industry is typically seen as a cost center. It's only about the cost of the drugs. We don't look at the value of those drugs. I reflect again on my comment earlier about the miracle of having a vaccine. But there are over 500 products for cancers and other diseases in development in Canada as we speak. We don't hear about those. Those aren't the stories that you read about in the news. So the fact that politicians, the Canadian public, have woken up to the value of the industry encourages me to believe that in fact we will have more of those dialogues. We have had tremendously positive conversations with Minister Champagne, and he's meeting with our members and looking for other opportunities to enhance domestic capacity in Canada. So I have hope that we will create that environment, that hospitable business environment in Canada that will allow my members, our members at IMC, to sell Canada to the global decision makers and bring that money here. We deserve better in Canada.
And the final thing, we're almost out of time, unfortunately. You alluded to this right at the beginning, but this isn't about any particular government, Liberal, Conservative, NDP. You want Canada to work with the industry no matter who's in power.
With the greatest of respect, politicians come and go. Canadians are here. Patients are always here. The industry hopefully will always be here. We want to do best by patients. At the end of the day, that's always what it's about. Patients don't get better. Our products aren't worth the salt or the paper that they're written or made of. It's not a very good analogy, is it? But yes, there's so much that can be done, and Canadians simply deserve it.
Well, thanks, Pamela Fralick, for setting the stage, and we're going to have a little more delve into some of these issues a little more in the panel coming up. And I'm going to turn it back over to Jennifer to introduce our panelists, and we'll be back in a moment.
Thank you, André.
Thank you so much, André and Pamela. Gives us a lot to think about to kick off our discussion. I also want to give a shout out to our audience and welcome people from across the country today. I see people registered from Ottawa, Halifax, Montreal, Winnipeg, and beyond. And we encourage everyone at home to share your thoughts on reflections on social media. We also love it when people take pictures of how they're connecting with us today, how you're watching this. So feel free to tweet or post on Facebook or Instagram. You can tag us at The Walrus. Now I'd like to introduce our panel to dive deeper into some of the issues that we've just heard about. And we invite the audience to submit any questions for the panel via the Zoom chat box. We've already received quite a few questions. We welcome more, and we'll try to get to as many as possible. Welcome to the Zoom stage, Reg Joseph, CEO, Health City, Dr. Alika Lafontaine, healthcare advocate, rural anesthesiologist, and Canadian Medical Association President-elect, as well Anie Perreault, Executive Director, BIOQuébec, and welcome back to our moderator, André Picard of the Globe and Mail.
Great, thanks Jennifer for the introducing all of our fine panelists. We're going to tap into their big brains. I'm just waiting for, I don't see Anie yet, but I'm going to wait for her to pop up. There she is. Bonjour Anie, bienvenue.
Bonjour.
So I think I'll start with you, Anie, just to build on what Pamela was talking about the need for a strategy. Now, Quebec is a bit ahead of many provinces. Quebec does have a life sciences strategy. So can you tell us a bit about that? And is this maybe a model for what Canada should be doing more broadly?
Thank you, André, for the question. Yes, I was listening, of course, to Pamela, and I'm one of the signatories of the letter that you've mentioned about requesting a national Canadian coherent life science strategy. In Quebec, we've had several tools to support the biotech and life sciences sector. And can I take a few minutes just to mention that the life science sector is not just the pharma industry, and Pamela speaks extremely well on behalf of the pharma industry, but I'm representing mostly biotech research companies, CROs, companies that are doing preclinical research, clinical research on patients, venture capitalists that are also quite involved in the life sciences sector. So the whole sector is a horizontal sector, it's not a vertical. And so that's very important to mention. In Quebec, you're right. We've been working with the Quebec government no matter what color it is, blue PQ, blue CAC, red Liberal. There's always been great support for the industry and kind of unanimously support of all the parties behind the industry. And that has really, I think, made a difference. It has had a positive impact on Quebec, and it has allowed the sector to flourish in the province. And right now we see this because we have a tremendous growth of the biotech sector, but also of the artificial intelligence industry, which is also supported by the government. And paired together, that's really making a difference. But in Quebec, we have a provincial life sciences strategy. That strategy was adopted in 2017, and it's also a strategy that is under the responsibility of two ministers, not just the Minister of Economy and Innovation, but also the Minister of Health. And that's also sending a very strong message, I think. And it's forcing the government to work together their policy, economic policy and health policy. And I'm not saying they're all coherent. We still have some work to do in the province, but there is at least that message where both departments, health and economy, has to work and better work together. In fact, because of the pandemic and because the life sciences sector has been identified in Quebec as one of the pillars for the recovery, the economic recovery, we are looking at the strategy again. The government has just announced the putting together 4 workshop. I don't know if chantier, I don't know how to translate it, a task force. And again, there's going to be an involvement of the health department and the economic department as well. So that's very important. The government, just as an example, has created an office of innovation so that person is getting funds from the Ministry of Economy, but is responding to the Minister of Health. And it's quite challenging. If the president of the office would be here today, I'm sure would have a lot to say about it. But again, it is a recognition by this government that both needs to work together. So yes, we do have tools in Quebec. I think that the federal government should be inspired by, because whatever the province of Quebec is doing, the entrance door for investment in Canada is Canada. So we need a Canadian life science strategy that is more coherent in Canada. We need one, first of all, there's none. And we need one that is going to be helping bringing all the people together, all the actors together, working with both health and the Ministry of Industry, Innovation. I can't remember how it's called in Ottawa, but those two, that's very, very important. And we are looking forward to see if the government is going to respond to that request.
Great, and gave us lots to think about there, and we'll come back to some of those issues in a moment. Reg Joseph, I want to turn to you. You're the CEO of Health City. Not everyone knows Health City, but it's a not-for-profit that is interested in better health outcomes, but also economic development and the melding of those two. So can you talk to us about that, the overlap a bit, what you think the priorities should be for bettering the links between this sector and government?
Yes, absolutely, Andre. Thank you very much. And what you said, I think, is a real opportunity for Canada. We are in a bit of a healthcare crisis, I would say. And I think the opportunity for us to leverage innovations and technologies that are being developed in this nation to drive better health outcomes are right before us. We make a lot of investments in our post-secondary institutions with respect to these kinds of innovations and adopting them into our health system. Both drives better health outcomes, but then also encourages the growth of this industry. The second point I wanted to make around this is that a life sciences strategy and this sector depends on data and our ability to use data across the system. And one of our biggest challenges in Canada, there's an article that recently came out in Maclean's talking about Canada's situation with respect to data. We need to be driving our healthcare decisions based on data. And that is a big challenge from a national perspective because we have a number of silos with respect to how data is shared across the nation. Actually, it's very difficult to share data across this nation. And so for us to have a comprehensive strategy around life sciences in Canada, data is going to be critical.
Mm-hmm. And we'll come back to that data issue is an important one. I want to ask you to follow up on something you alluded to, the investments in universities that we make there. One of the questions in the chat already is about that, this perception that governments invest a lot, in new drugs, new technologies at the university level, but all the benefits come to industry. Is that fair? Is the public perception about that wrong?
I think that our real challenge here is the fact that we do develop new ways of practice, new innovations all across our post-secondary institutions in Canada. Our challenge is not that it goes to industry. Our challenge is that they're not being adopted by our health system. And our health system is antiquated in its ability to review and adopt these innovations. And hence, they either sit on the shelf or they find their way to market through different jurisdictions. And so that is the problem, Andre. Not that it goes to industry, it's the fact that our health systems aren't picking them up.
It doesn't go to the patients.
Yeah, we're slow to adapt. It takes, I think, 17 years in Canada to adopt new technologies. We're a bit slow off the mark. Dr. Alika Lafontaine, President-elect of the Canadian Medical Association, congratulations on that recent vote. I want to bring you in to talk about the clinician point of view. So doctors, nurses, pharmacists, et cetera, why do they care if there's a life sciences strategy? Does it matter ultimately to those professions?
So I think as a frontline provider, we're sometimes ignorant of the broader ecosystem that really creates what we depend on day to day, which is, things that are effective and impactful for patients so we can help, individuals navigate the health system towards their best healthcare. I do see these problems that has been brought up by both Anie and Reg, that if we don't have a coordinated strategy where we can take made in Canada solutions and scale them across our own health systems, we're really going to struggle to keep up in the global marketplace. And we can see, especially with vaccines, it's been amazing that the entire world has been focused on solving this problem. But when it comes to actually accessing the solutions, although it is incredible that we're here right now, we're having a very difficult time accessing those things. There's so many made in Canada solutions that are exported to the US because it's just an easier market to get into. We often talk about Canada being the land of pilot projects. In reality, even when you have a successful one, it's really hard to scale it, even if you have evidence. And I think we have seen some movement. There's the Can Health Network that was recently set up, in order to bring innovations into one part of the healthcare system in one province and hopefully scale across other members of the network in other places. But things like this and integrating more closely with insiders within industry and, advocates like Health City is a really important step in making sure that we can actually vet these solutions. Should we adopt every single innovation in frontline care? No, we shouldn't. We should be picky, and we should make sure that we choose the things that are most impactful. But right now, what our focus is on in the health system is just what's the cheapest. And that's not any way to build a well-designed system.
And you, as a clinician, you're an anesthesiologist in your day job. You feel the impact of these policies, right? You deal with drug shortages every day, with patients who can't get their drugs that they want because they're not approved, et cetera. So there's real life consequences of these abstract policies.
Yeah, absolutely. And I think it's really important, especially for patients, to realize once you hear about a drug shortage, it's been going through the system for months. We've known about these drug shortages or insufficient access to equipment or other consumables for quite a while. And we recently had, rolling shortages of, things like propofol, which is a really important drug when it comes to anesthesia. If we run out of propofol, we're going to have to cancel a majority of anesthetics in the country, and that impacts everybody, and so these are really important questions for us to answer. The biggest problem, I think, with a lot of these policy questions is they're years in the making. So even if we create a strategy now, we have to keep it going for several years and continue to support it. And it's not a quick turn on, turn off sort of thing. And so you need policymakers who can really see far into the future and really develop these relationships that we're talking about.
And Reg, if I could come back to you to talk about a little bit what Alika alluded to, this notion that we pay a lot of attention to cost in Canada, but we don't pay a lot of attention to value. How can we change that conversation, not only about drugs, but about health spending more broadly?
Yeah, and I think, so one of the challenges there is that, when we look at those procurement policies, and Alika mentioned that, we look at sort of the lowest cost alternative, it hasn't worked for us. our health costs continue to rise every year. Many provinces now are hitting 50% of their provincial budgets are being spent on health. The rise is going up 6% on average a year. And so that methodology hasn't worked. I think what we really need to start looking at is a sort of total cost of ownership model. Like, how do you drive better health outcomes and wellness, and what types of solutions do you bring in to do that, as opposed to looking at saving dollars on gloves and needles and so forth. And that this is the perspective we need to take. And as you also well know, one of our biggest challenges is the emphasis of acute care in Canada. Other jurisdictions who've been able to demonstrate movement in terms of being containing health costs have brought in community, the side of community and community-based care. And that's where our emphasis needs to be. So as opposed to investing in the new advanced tools in acute care centers, we need to be really focusing on how do we prevent and manage these chronic diseases in community. That's what's going to help drive down our costs. And so those are the kinds of solutions, André, that we should be looking at as well, that are more broad and robust in terms of managing those chronic diseases, as opposed to looking at, say, surgical approaches.
And Anie, I wonder if you could weigh in on this. I know this is a conversation industry has with government all the time about value versus cost, investment versus expenses. Can you talk about how do you have that conversation with politicians who are really focused on today?
Well, thank you for letting me putting my little things on this. Actually, we're doing a study in Quebec on the integration of innovation, health innovation in the system, and we are currently doing some discussion with the government about this. It's all the difference between, first of all, I think in Canada, we might have a problem in dealing with the industry because it's cultural. We have a public healthcare system. And so it's all nice when we fund research at the academic level, but when companies are coming out of universities and they're created, and we have startup, and at one point they have a product, they become a company, they become private, and there's like a discomfort. And I think it's cultural in many parts, but there are countries that have public healthcare system and that are doing much better than us in terms of conversing with the industry and trying to integrate better and offer to their citizens the innovation, the health innovations. And Germany is certainly one of them, where they have a constant discussion with the industry, and the Scandinavian countries, of course. So what are they doing? Well, Reg mentioned we need data. We need more data. We need to stop thinking in terms of cost and start thinking in terms of value. But for that, we need to better understand the outcome of those health innovations. So why not sometimes maybe have integration of those innovations, and for a year or two, look at the impact and negotiate the price of those medicines after. And that is actually happening in some countries. Like I know in Germany, they have some program about that. So there are solutions, but for this, you need to integrate the businesses into the conversation. And that's where there is a difficulty I find in Canada. There is a cultural problem that we need to turn around. And this pandemic is probably helping us big time. I mean, it would have cost us millions of dollars to have done a public relations campaign about what is life sciences industry and what we do and what is a vaccine. Now the population is informed, they know about it, they are interested, and they've seen the impact. And I think they want the industry to be a pillar for the economic recovery, but also for the health system in Canada. So we have all the timing is perfect. So we need now the government to get involved and say, okay, let's change the way we think, and let's work and bring not only just the Canadian researchers, the academic researchers, but also the biotech, the pharma into the conversation. And I am convinced that we can find a solution.
I think every panelist has used the word opportunity a couple of times, so we'll come back to that, what the opportunities are ahead. I want to thank Eva for her posts in the chat. There were some really complex mathematical formulas there, and I was puzzled how to make a question out of them. And she's told us that was her cat jumping on the keyboard. So thanks for clearing that up for me. And it's not a good panel if we don't have some visits from pets or children. Hopefully we'll have no naked MPs today, but you never know what can happen during a live event. So Reg, I want to get back to you about your data question. I know this is this topic that's near and dear to you. What kind of data do we need, and how can it influence? We know politicians are not always influenced by numbers. A lot of it is emotion, but how can the numbers change things?
You know, what we really need is outcomes data, and we need to be able to share these outcomes data across the nation. And that's when we can get a better handle on, Anie, to your point, if we're looking at a particular innovation or an intervention, does it work? Does it actually provide the outcome that we're looking for? And that's something that we're lacking on. You know, we earlier in the conversation, Andre, with Pamela, we were talking about, you know, pharmaceutical budgets and the prices of drugs and how we need to control that. Now, let's not forget the pharmaceutical budget in healthcare. The spend is only about 5 to 7% of overall healthcare dollars. Right? It's a very small amount of money, but the reason why we focus on it is data, because we know how much those drugs cost. What we don't know is the cost within our own systems and how much money we're actually deploying in terms of treating diabetes or treating side effects related to obesity. And so it's outcomes data that's critical that we need to get a handle on, and that's how we're going to be able to move the sector forward.
Yeah, we don't know what are we saving. Like right now, we have a vaccine, we have vaccines, people are getting vaccinated. It's difficult to have data about what would have happened if we didn't have that vaccine. You know, outcomes data are extremely important. And that's why I was alluding to that earlier in projects that could be put together for other medicines and other treatments, and trying to get that as much as possible out there.
You know, just to
Alika, sorry, go ahead.
Yeah, just to add to that, I do think with the outcomes data, we really have to get away from cost savings as the only kind of data that matters.
Exactly.
Yeah, you look at the QI framework within Ontario, there's 350 different metrics, and the majority of all of them are either volume-based or they're about how much money the system is saving. You know, there's so much data linked to lived experience, you know, the behavior of patients, the behavior of clinicians, you know, whether or not they adopt and improve quality of life and functionality and all these other things. And I do think that there's a strong role for everyone in this space to really advocate that we need to move away from, you know, these volume for dollar or, you know, cost savings for dollar metrics, because they're not really leading us towards better designed health systems.
And I was going to ask
away from silos.
Maybe you can elaborate on that. Like, what metrics do matter? You know, there's an expression that if we don't count it, it doesn't count, right? So it's important what we choose to measure. Where do you think our focus should shift?
So I personally think that there's been a bit of a movement towards asking patients what their actual outcomes are. You know, there's a wonderful thing that happens in startups called customer discovery. You know, you actually ask people whether or not they want to use the product that you do and whether or not it solves the problem that they have. You know, I think quality improvement metrics that move towards that kind of area, and it's well developed within startups and, you know, innovation type frameworks. It wouldn't be difficult for us to lateralize some of those things. I think in medicine, especially in medical research, when you're looking at clinical applications, we sometimes dress up that language when in reality, it's just asking people, is this working for you? Do you want to continue to use it? I think the second part is really focusing on patient harm. So one of the things that we know within Canada is that patient harm isn't reported at a very high level. And this may be because of medical misadventure, it may be because of bad decisions from clinicians or misuse by patients, or it may just be products that create harm that maybe is unknown until you start to scale out the use of your product. And I think getting better reporting on that harm aspect also leads to, you know, that eventual outcome of making the system more sustainable, because you avoid interventions that create things that maybe they shouldn't.
And as you've talked about often publicly, the harm often comes to people who have the least ability to complain, to get results. So that even exacerbates the problem.
Absolutely.
Now, Reg, I want to come back to that data issue about what do we measure? Well, what do you think's missing? What's the missing piece of the puzzle here that would help us realize the value of life sciences investments?
Yeah, the real opportunity here is to picking up for where Alika left off, which is really looking at that patient's input and their progression or minimizing their progression of their disease, and understanding do the certain inputs actually work to drive those kinds of outcomes. So that's the real key aspect here, is actually tying in the patient and their particular outcomes. And so quite often, we talk about the Canadian sort of parental type system where it actually excludes the patient quite often. And I think that's one of our key mistakes in Canada. We need to include the patient in, and the patient is going to be part of the team in terms of driving those better outcomes. And so those reported, have the patient accessing data, have the patient being able to communicate back to the health system, so that you have this two-way communication, which happens in many other environments, but it doesn't happen in healthcare. In healthcare, it's always a one-way communication from the system to the patient. And so you never get that feedback. And so Alika's point there is, how do you get that feedback in, work within that system so that the patient is providing that positive feedback in, so we know what's working and what's not working. And that's a big system, because as you know, that's not going to happen if we use fax machines. We need data infrastructure to be able to do that, and that's where the investment is going to be required, is to be able to establish that type of infrastructure to enable that.
And Anie, we're getting some questions in the chat about, industry is talking about the need for investment, but what's the other side of the equation? What are they willing to give up? Are they supportive of things like pharmacare and lowering drug prices? So what about issues like that? What's the other side? What's the give?
Well, just before I get into that, if I just want to pick up on what Reg just mentioned, because I'm here today and I'm just arriving from, I was patient 1, phase 3 of vaccine, Medicago vaccine today. Medicago, Quebec company, COVID vaccine. So I didn't know it was patient 001, but I was. In any case, they've downloaded an application on my iPhone, and they're going to be following me for the next year, and so in terms of getting outcomes and data, I mean, we have the technology now to get the patients involved big time. And so I'm actually right in the next hour, I needed to mention if I had, side effects, whatever. And I'm going to be telling them if I'm still working or I have such a headache that I can't work. It's nothing of that is happening. Actually, I'm doing great. But just to let you know, those things, we have the technology to involve the patients a lot more. So I wanted to it's not like it's difficult. It's feasible. It's a question of will, I think. So and we have all the opportunities right now. To get back to your question, André, of course the industry is looking at, in Canada we have a system. In Quebec, it's a little different, but anyway, there's a system where all the provinces are talking together already in terms of the price issue. And quite honestly, maybe Pamela would be better than me to answer this, because I'm more into the biotech and I'm less into the medicine already on the market. But so I have not been involved that much into that process, but I know that there's already discussions in Canada between all the provinces, and Quebec is now part of this, to make sure that we are negotiating the best price possible with the companies. It's not like nothing is happening. In fact, things are happening. What we need to do better is not to impose on the industry, but to involve the industry in the discussion. And that's probably the biggest difference. I mentioned Germany earlier. They've made a lot of changes in the way they structure the price, but they've involved the industry right from the start. And that included better integrating the products into the market, but getting data out of it. So that's the kind of thing that needs to be better done. And of course, we are willing and interested in doing that. And the reason why the biotech sector is interested, because it used to be just the pharma, it's because we know that we are no longer a siloed industry vertical, as I mentioned earlier, we are horizontal. We need to work all together. What's happening at the Canadian Research Academic is going to have an impact at the end if Canadian patients do not benefit from it. And we have quite a few examples of this Canadian discovery that have not been integrated yet and are being used other places in the world. And that's quite frustrating.
Great. Maybe we'll get Pamela to jump in on the chat and she can type in an answer. Maybe that's one we'll tackle some questions that way as well. Alika, there's a couple of questions I think I'll send your way about social determinants of health. I know you're very eloquent on that point. Someone is noting that technology is great, but it has social biases. It doesn't benefit people equally or equitably. How do we ensure that part of the puzzle in our strategy?
I think one of the ways that we address that is by actually implementing technology and then seeing how we can mitigate it. You know, it's kind of a chicken and the egg phenomenon. Is, you know, we often focus in the Canadian market about all the barriers to bringing in a solution instead of bringing in the solution and then purposely making sure that it's accessible to certain vulnerable groups or groups that have restricted access. You know, I do think that you can leverage, you know, access within places that people already have care. You know, if somebody doesn't have a personal computer or a personal iPhone or iPad, you know, you can create some sort of public access, you know, through a library or a clinic or other sorts of places. But these are places where, you know, the intersection of the industry, frontline clinicians and patients can really find innovative solutions for these things. You know, I do think that 10 years ago, that question might have been a bit more applicable. And I do definitely believe that, you know, persons who are homeless or from very disadvantaged, low socioeconomic backgrounds do really struggle to get access to technology, but it's much more ubiquitous now. And so I think that cost value proposition is maybe a little different nowadays.
And a question I'll send to you, Reg. People are asking, you know, we talked about the importance of outcomes, measuring outcomes. How do you reward people who get good outcomes once you have the measures?
It's a good question. I think, to be honest, I mean, I think most individuals are motivated to drive their own health. And I think that is motivation enough. I think the challenge now, as I mentioned before, is having that positive feedback loop. You know, many patients sort of know what they need to do, but they don't have that feedback in terms of when they've taken certain actions, is that actually having the positive feedback that we need? So I think that's one piece. I wanted to pick up on something that Anie and Alika said, and I think we need to look at things slightly different. The question, André, that you asked was about, you know, will companies be willing to start looking at different pricing models and so forth? And that is happening. And you've said that in different jurisdictions, that is definitely occurring. But I want to pick up on something that Alika said, which is we actually need to transform our health system. So this conversation about can we have a pricing negotiation and will the industry be fair about pricing is actually antiquated. We need to look at a complete system redesign, and the next generation of companies, health companies, are actually looking at solutions that address these problems. They're not looking at point solutions in terms of reacting to a disease. They're looking at how do we prevent the disease. And so you're starting to see pharmaceutical companies and other companies move upstream because they know that that's where the pain points are. So industry is already there. We now have to follow up in terms of our health systems being able to have those same conversations.
I think that conversation will take us a little more than an hour, but maybe we'll tackle it at a future Walrus event. We're almost out of time, so I always like to end panels on a more positive note, so I hope we can do that. So I want to ask each of you briefly to tell us what gives you hope going forward that these things are going to change. Has COVID really changed the conversation? Has it changed the ecosystem that we're really going to tackle this? Anie, maybe you can tackle that first. You hopeful going forward?
Yes, I am. I've mentioned it before. I've been involved in the research industry for 20 years now, first at Genome Canada, now at BIOQuébec. And I can tell you, this is the first time I'm reading news about science and life sciences every day. Like, it's top of mind of everybody. And I think we need to capture on that. And for the first time, we're probably going to get into a federal election soon. There's a reason why we published that letter recently.
Really?
Really, yeah. So this is probably the first time that life science is going to be top of an electoral of election. It's perfect because Canadians wants to know more. They deserve to know better and to understand and find out what their government wants to do. And we need to, so I'm very optimistic that actually because of because of the pandemic, which is very, I mean, we're not finished with it, unfortunately, but there's light at the end of the tunnel, and the light is coming from our industry. We need to recognize that it's coming because of people that have made that research, and very quick research, and delivered a vaccine. I think this is a great opportunity to tackle those issues and bring together the impact that our life sciences sector can have both on Canadian health of Canadians and health of our economy. And we can actually bring the two together. And it's not contradiction. We have to stop thinking that way in this country. And I'm hoping that we're going to bring it together for the best, because we have in Canada quality of research that is amazing. It is recognized around the world. What we do in terms of research is, for the population that we have, is top notch. So we need to be proud of that. And we just need to move it a little further and make sure that our citizens will benefit from it better. I am optimistic, as you can see.
That's great. Optimistic, vaccinated, you've got all the bases covered.
Vaccinated, I don't know. I might have received the placebo, but I'm hoping.
A positive person doesn't think they have the placebo, but I think you made a really good point too, that, it's been a hard year, the last year, but it's been a tremendous year for science and making us appreciate science. So that's something.
And understand it better. And for so many people to find out, it takes so many years to develop a medicine. And we know it because we're in the system, but a lot of people do not know about it. So it was wonderful that actually, even if it was sad, the pandemic, and it's still a difficult moment for everybody, I think it's good for the life sciences. Yes.
Now, Reg, let's see if you can be as optimistic as Anie. What do you look forward to going forward? Where do you see the opportunities in this sector and in the connections?
Sure, absolutely. I fall on the side of optimism as well. And I think, it all comes down to a new way of looking at things. We're in a new age. The speed with which the world was able to get a vaccine to the market is unbelievable. And that has opened up a new way of looking at things, a new way of thinking. During pandemic, and you mentioned this, André, that has changed how health systems view their processes. And so I have seen changes all across in many provinces. We have a long way to go with respect to virtual care or home health monitoring, even new data techniques like synthetic data, which is enabling us now to share data in safe ways. This is all accelerated as a result of the pandemic. And most of these things have happened much quicker than they ever would have if we didn't have that. So I think we're in a scenario where things are moving quickly in this sector. Our goal now is to keep up that momentum and use some of these methods that we use to get these solutions out into the hands of patients, use that as our main way of continuing forward and not to revert back.
And what's the starting point? What's the one thing you would do tomorrow if you had the power?
I would, really put the power in the hands of community-based care providers to drive where our health system needs to go in Canada. Right now, it's being driven by acute care. It needs to be driven by community care.
So Alika, Reg has just put the power into the hands of clinicians. What are you going to do with it? How are you going to be optimistic going forward?
I've said this a few times in some other panels, but, across Canada, we've all become armchair epidemiologists, right? We pay attention to the data, we process it ourselves, we're coming to our own conclusions. And, I think we've reached a tipping point with COVID that's been building for a long time. The way that we communicate and the way that we network and the way we can access information transformed in the last 10 years. And I think COVID has magnified the good and the bad with how the health system has been going. Those who have suffered are suffering more, but those things that work well are working even better. And I think The vaccine developments that we've seen over the past year is a great example of that. And so how can we as consumers and clinicians and other members of the health system really continue paying attention and consuming that data and participating in these conversations? We have hundreds of participants in this type of panel. I couldn't have imagined this happening, 1 or 2 years ago with this type of participation. And so when people pay attention, I get very optimistic, because that usually means that change is around the corner.
Great. That's a great note to end on. How can people not pay attention to this great panel? I'll just finish by quoting someone from the chat who says, thank you for a great panel, and calling you the superheroes, the silo busters. So thank you for silo busting. Thank you for your insight. And I'm going to turn it back to Jennifer to close out the event. But I want to thank the panelists personally for your great insight. Thanks.
Thank you so much, André. And yes, thank you, Reg Joseph, Dr. Alika Lafontaine, Anie Perreault, and Pamela Fralick, and everyone at Innovative Medicines Canada for making this conversation possible. André, we're really grateful for your time and moderation and humor. And for more of André's insights and reporting, you can read his latest book, Neglected No More: The Urgent Need to Improve the Lives of Canada's Elders in the Wake of a Pandemic. That title really says it all. Thank you as well to our annual sponsors, Inspire, Labatt Breweries of Canada, Air Canada, and Shaw. And thank you at home, for joining us today. If you enjoyed this, we have more coming up. On May 11th, Carleton University presents the Walrus Leadership Forum, Strengthening Canadian Journalism. I'm really looking forward to that one. And to stay on top of events, as well as to watch video from this event and other events, you can go to our website, thewalrus.ca/events. Also keep an eye on your inbox, because you will receive a follow-up email from this event. And the best way to not miss anything is in that email to sign up for our newsletter. We need you to opt in, and then we can keep you up to date with what we have on our calendar. Here at the Walrus, we believe that trustworthy journalism is an essential service, and we've really seen the importance of fact-checking in journalism throughout this pandemic. And with your support, we can continue to provide fact-based, long-form journalism that Canadians can rely on. So if you enjoyed this free event, please consider making a donation at thewalrus.ca. Click on donate. All gifts of $20 or more will receive a charitable tax receipt. Community is really important in these COVID times with stay-at-home orders, and it's been great to be with you today. And each one of you is ultimately part of the Walrus. Thank you all for tuning in. Merci, miigwech, and enjoy the rest of your day.